Welcome back to our channel, Heart Fitness. Today, we're diving into a groundbreaking development in the world of cardiovascular health. The US FDA has recently approved a new low dose of a drug called colchicine for use in atherosclerotic cardiovascular disease, or ASCVD. This represents a completely new approach to treatment, specifically targeting inflammation as a driver of atherosclerosis. So, let's delve into this exciting development. Today, we're going to talk about a groundbreaking development in the field of cardiovascular health. The US FDA has recently approved a new low dose of a drug called colchicine for use in atherosclerotic cardiovascular disease, also known as ASCVD. This is a completely new approach to treatment, specifically targeting inflammation, a key driver of atherosclerosis. Let's start with a brief overview of what atherosclerosis is. Atherosclerosis is a disease in which plaque builds up inside your arteries. Over time, this plaque hardens and narrows your arteries, which can lead to serious health problems, including heart disease, stroke, and even death. Now, let's talk about inflammation. Inflammation is a natural response of the body to injury or disease. However, when it comes to atherosclerosis, inflammation can be harmful. It can lead to the formation of more plaque, which can further narrow the arteries and increase the risk of heart disease. This is where colchicine comes in. Colchicine is a drug that has been used for many years to treat gout, a type of arthritis that causes painful inflammation in the joints. But recent research has shown that colchicine can also be effective in reducing inflammation in the arteries, thereby helping to prevent the progression of atherosclerosis. Dr. Michael Joseph Blaha, Director of Clinical Research at the Cicerone Center for the Prevention of Cardiovascular Disease at Johns Hopkins Hospital, believes that the approval of low-dose colchicine will lead to more discussions about residual inflammatory risk in patients. He suggests that the drug's use will depend on the context for different individual patients. In India, where heart disease is a leading cause of death, this new treatment approach could have a significant impact. For example, consider a patient in Mumbai who has been struggling with heart disease despite taking statins and maintaining a healthy lifestyle. With the introduction of colchicine, this patient now has a new treatment option that could potentially reduce their risk of future heart events. However, it's important to note that not all patients with ASCVD may need to take colchicine. Some doctors, like Dr. Steve Nissen, professor of medicine at the Cleveland Clinic, Ohio, believe that colchicine should be used selectively in those with raised hsCRP, a marker of inflammation. This is to avoid polypharmacy, or the use of multiple medications, which can lead to potential drug interactions and side effects. In conclusion, the approval of colchicine represents a significant advancement in the treatment of ASCVD. By targeting inflammation, this drug offers a new approach to managing this disease, potentially improving the lives of millions of people around the world, including here in India. Remember, while advancements in treatment are important, prevention is always the best medicine. Regular exercise, a healthy diet, and regular checkups with your doctor can go a long way in keeping your heart healthy. Thank you for joining us today on Heart Fitness 1984. We hope this information about the role of colchicine in cardiovascular health has been informative and helpful. Remember, your heart health is in your hands. Stay tuned for more updates and don't forget to like, share, and subscribe.